This conference will now be recorded.
Well, good morning. It is a chilly February morning. My dogs were in and out in a moment this morning, but hey, I want to welcome you to the Worksite Wellness Council of Louisville's February Wellness Conversation. We're really excited about our facilitator this morning, and to do a quick introduction of that person, I am going to, let's see, she's already unmuted. Patrice Fife, who's one of the wonderful duo who helped set up our programming. Patrice, if you want to do the honors.
Good morning. Good. Thank you, Matt. And good morning to each and every one of you. As Matt stated, we are so thrilled that you have joined us this cold Thursday morning, and hope that you are warm and safe and staying healthy as well. I would also like to honor my co-chair, Mary Stewart. She's on this morning, and I'm just so thrilled to have her as a co-chair with me, working to bring you all the best that we can possibly bring you in our programming. We want to introduce this morning Ms. Lydia. She's with Moxie Girl, and her passion is to improve the mental health of young ladies, and she is very astute. She holds a degree in marketing and an MBA in international business and a doctorate in organizational behavior. She has a strong background, of developing and commercializing technical innovations across various industries. And without further ado, we are going to turn the floor over to Ms. Lydia. Welcome.
Can I actually ask, I have one request of our audience. You know, as I look at my screen here, I see 5 faces, and I just have a request. Now, if you really can't do it, I mean, if it's a rough morning, okay, but I have the one request that, boy, it'd be great if we all turned our cameras on so that Lydia knows who she's speaking with, and obviously when we have some participation, that you guys are in there with me. So who's with us? Come on now, we can pop. There's, all right, I'm starting to see some cameras pop. But anyway, just a quick request, and thank you for that. And Lydia, sorry, I didn't mean to jump in, but I thought that would be a nice request for you.
Oh, thanks, Matt. I appreciate that. Yeah, that's great. It's wonderful to see faces. It's wonderful to see initials. Faces are, like Matt said, faces are always better, but I'm just glad to have you all here today, and so glad to be here with you. I was telling Matt, I'm really glad that, I'm inside. We're all inside. I think we're doing a lot better than the little birds that are outside looking for some nuts and berries and seeds. So thank goodness for hot coffee. So as Patrice said, I am Dr. Lydia Henshaw. I am so happy to be here with you today. I'm calling in from Jeffersonville, so right across the river today, and really excited about the opportunity. So we are in the business of supporting families so that parents can bring their best selves to work. And we do that at Moxie Girl by helping youth, and specifically young girls, feel better. To give you just background on us, we work with healthcare providers, we work with schools, and we work with state agencies across the U.S. to help support youth mental health. But before I tell you any more about that, I really wanted to hear from you all this morning and just learn about how your wellness programs are doing through COVID. And I wanted to just start with an icebreaker to kind of get some conversation going, to hear from you about how your corporate wellness programs have changed as a result of COVID. So if you have thoughts, or if you have any comments either about maybe how you've seen adoption change, or maybe other services that are being offered, or other support networks that are being created, I'd love to just get a conversation going in the chat to kind of learn more about your programs and how you all have been faring through COVID. So who's up for sharing some insights?
So I'll say, either if you want to put it in the chat box, again, upper right corner, should be on either phone or computer, a little circle, or to be honest, if you want to, I don't want to unmute everybody, that's dangerous, but if you want to go down, you can unmute yourself, you scroll down and look, there's a little circle that's says mic, and you can click on it and unmute. So who's got a thought? Who's got a response?
I see Marcy says, can you repeat the question? So the question is, how have your wellness programs, your corporate wellness programs changed as a result of COVID? And so I see, let's see, Laura says, our wellness program has been paused due to the high demands of COVID. That is fascinating, very interesting. Candace, many programs have been virtual, making sure that everyone is aware of services, raising awareness for mental health, virtual offerings, weekly wellness, teledoc type services. Yeah, I think, this is really common that we're seeing across many of the states that we work in too. And I think, we'll talk about this a little bit later on in the program, but uptick in communication, more focus on mental health, screening tools. A lot of states too, we've been seeing a lot of state legislation, putting in budgets for continuation, expansion of telehealth type services. So I think, this is kind of the new normal. So kind of thinking about how do we deliver similar support or more support, focus on mental and behavioral health so that we can get at the prevention side of it, but then also we can get at the support side when we realize that people do need that help. And I see Tiffany putting in constant communication to all employees, encourage employees to focus on wellness. Just as much for not only families, but also how are employees themselves taking, inserting breaks in the day and kind of pausing or finding new ways to focus on wellness so that they can keep bringing their best selves to work. I like Mary Stewart's comment about tailoring challenges to include more family-oriented activities and stress-relieving activities. This is great insight. Thank you for sharing. Feel free to keep adding into the chat, and what I'll do is I'll launch into the rest of the slides, and I want to just give you kind of a roadmap for how I was thinking about our discussion today. One, I was thinking about it as a discussion. So as Matt said, and as Patrice said, I'm here to facilitate a discussion and share some of the experiences we've had at Moxie Girl as we worked across different states and with different providers around how to support youth mental health and also specifically female mental health for girls and young women. But there are a lot of data points that, really support the conversation about the importance of connecting youth and connecting families with resources during this time. So what I have prepared for you today is just some great data. I'm a big data-driven person, so I like to start with the data and then say, what kind of a narrative does this tell us? What kind of conversation can we have as a result of it? And so my hope today is to answer a few questions that might be going through your mind. Specifically, why youth, why Moxie Girl, and why now? And as you all read these questions, you may have answers that are coming to your mind. And I've structured the presentation so that we can have some pauses as we go through, because I'd love to hear your feedback as you hear the data and as we talk about ways that we can help support youth and ultimately support families. So how does that sound to you all? For the faces that I see, thumbs up. I see head nods and smiles. Okay. Okay, so why youth, why Moxie Girl, and why now? So you are in the business of creating corporate environments so that employees can bring their best selves to work. And we want to support you in that today in the conversation. And we want to give you some information to help create an environment so that parents can bring their best selves to work. So at Moxie Girl, we start by treating their children. And so I thought it would be good to just understand what is on the mind of parents today. And I don't know if you know this, but as of December 2020, 54% of parents in the US are concerned about their child's mental health, specifically depression and suicide. And now, while those thoughts are not new, the prevalence of the number of parents that are worried about that has really significantly increased as a result of COVID and isolation and the challenges that youth are going through. But what's interesting is that when we think of depression and anxiety, we might tend to think of it as something that is affecting an individual, but it's also important to remember that depression is a family affair and mental health is relational. And so, we know this, but we're social creatures. We exist in families and we exist in networks. And so our well-being comes from these relationships, and our highs and lows come from that too. And so naturally, when parents see their children struggle and when families see children struggle, that affects their mood as well. And so there's been some recent data from Northwestern University that shows this bidirectional link between a child's mental health and their parents' mental health. So it shows that when a child's mental health improves, their parents' spirits lift as well. It sounds simple and it sounds obvious, but when children feel better, parents feel better too. And so just as a starting point, that is really a big opening to why youth. Because we know that youth are struggling today, and we know that when they are struggling and that's on parents' mind, that affects how parents are showing up and how parents are coming to work. So this is one way we can start by opening the conversation about how to help parents bring their best selves to work. So I'd be curious to hear from you. How does this number strike you? Is it surprising? Is it too low or too high? Any thoughts? Feel free to put them in the chat if you have them. And if not, I will keep going. Seemed low. Yeah, that's interesting. Yeah, I do. Thinking it would be higher based on COVID. There's some other data that shows, other high worries for parents are, drug use and also social media time, which, kind of has some ties to depression and suicide. I think Patrice said not surprising due to current situations. So this is the current state of affairs, parents, what's on parents' mind. So I think the next natural question is, well, if parents are worried about this, how prevalent is it with teens? And so I don't know if you all are aware of this, but, this is pre-COVID data, but 50% of chronic illnesses begin by the age of 14. This was really startling for us when we started Moxie Girl and we started getting into kind of the prevention approach, that looking at this, so many of these chronic illnesses that youth and young people face today start so early in life. And I think that this data really reinforces why we should be proactive about offering solutions to parents and families that can help identify and maybe even screen for, but then treat and offer solutions for these types of illnesses in teens today. So more data for you. How are teens doing today? Again, probably not a surprise for any of you all, but 1 in 5 teenagers have symptoms of a mental health disorder. And then some interesting changes as a result of COVID. Suicide is now the second leading cause of death among teens. We were having some conversations about this even before the meeting kicked off, about just how every one of us, whether it's a child or whether it's someone in our network, we're close to this conversation today. It's on the mind of parents, it's on the mind of families and youth, and it's becoming a more common conversation. So I think, I wanted to share this data point just to kind of orient us into how youth are doing and what's on their minds today, and then how we can start to turn the conversation towards wellness and towards hope for them. So, a couple other data points I thought could be interesting to share just as a result of COVID and how youth are doing. Emergency room visits are rising. So March to October of last year, the proportion of emergency visits for youth actually rose 31% for youth aged 12 to 17. Teens are worried about finances. Teens are worried about family members getting sick. And then there's just this natural challenge that teens are facing, almost taking it a little harder than adults, these milestones and activities that are so important for their mood and their social connectedness, graduations, athletics, is really taking a toll on them and affecting loneliness. And a lot of research are saying that this could affect the future mental health of youth. And so really creating that conversation around how can we offer solutions and how can we offer benefits to really address where youth are today, but also take a long view of this, knowing that, even if things go back to quote unquote normal in the coming months, how do we handle these struggles that youth have been through in the past 12 months and are going to continue to experience as things shift, to be there for them and to be there for the families that are working to focus on their well-being. So I'd love to hear from you before we kind of get into the conversation about girls. How are these numbers sitting with you? How is this data sitting with you? Or do you have stories to share based on either youth that are in your life or youth that are on teams of, in the lives of folks that you work with or folks that are in your companies today? I see Brooke says that this weighs heavy on the minds of parents, and so this resonated with her.
And I'll just remind you, if you want to speak, I mean, you certainly you can live. Just go down. There's the mic button at the bottom of your screen. And I'll go ahead and share this, Lydia, because we talked a little bit before we got started this morning. So I have a 20-year-old daughter, and when she was 16, so she's a freshman in high school, little friend group, and one of those teens took her life. And so the point I get to is, she's a well-adjusted child. I mean, woman now, but she's a pretty together person. But I'll be honest. I mean, obviously, you get in a group of friends, and in that kind of scenario, there's a lot of different personalities. Some are stronger than others, and I was proud of my daughter because she helped folks through it. I mean, they're still now a very tight-knit group, from high school. They're all in college now, but anyway, that's the type. I mean, it obviously that was an extreme scenario. It was thoroughly unexpected. It's still brutal because obviously we know the parents, and their daughter's always 16, so it's just a strange scenario. But I just, I thought I'd share that as a starting point. It's a thing that it does affect everybody, and again, it was probably honestly more impactful to my wife than it was to me, because she was, she's in the home, and it was a very, very challenging little moment that fortunately, we feel fortunate that we moved past. So.
Yeah, and Lydia, I wanted to share, so I've got a senior this year, so she's 18, and I think in the teen age, whether female or male, they start thinking about college or what's next in life in general. So that's, I think, part of why some of this even gets exacerbated more with COVID happening. I mean, this whole entire year, she has not had any opportunity for any gatherings. They did a hybrid program a little bit, but it's still not the same for your senior year where you look forward to that. So I think, it is scary to me. I'd love to hear more about, what you're finding, especially since you're looking at this nationwide, to see if there are any tips that might be helpful for parents as a whole with everything. Because I think suicide has risen, statistically, unfortunately, in the teenage, because I think there's this feeling of hopelessness a little bit from some of that. So I just wanted to share that.
Yeah, thank you for sharing that, Tiffany, and Matt, thank you for sharing that story too. And I think it really speaks to the prevalence, and it speaks to the few degrees of separation that we all are to youth that are in need of help, and youth that are really feeling that. And I think a lot of the research shows that there is some evidence around kind of how this shared experience can be a collective force, that kind of youth now have this same sense of loss. They've kind of all gone through this collective trauma, if you will, together. But at the same time, there can be that feeling of hopelessness and that feeling of, endlessly staring at a screen, which we feel as adults, but we have different milestones that we faced, and we have different paths that we're on in youth. A lot of the research that shows like these adolescent years are when even though communication and relationships are hard, that's when a lot of the nuances of you figuring out your personality really come to be. And so without those moments, you kind of lose those opportunities. So we definitely have some resources that we've been sharing with parents. And I was telling Matt earlier before we kicked off that one of the things I can do is just share kind of a list of resources and some of the things that we've pulled from, within our network and that we've been provided from therapists and from providers that we work with. So I'd be more than happy to share some of that out after this presentation as a reference point for anyone who might be looking for some of that too, if that's helpful. Definitely. So, the last part of data that I'll share that is sort of I don't want to say on a downward trend, but I didn't want to leave you all hopeless, but I did want to stress the importance of the data. And it's hard data to look at. It's hard, it's emotional, it is personal. It's very hard. And so but I don't want to leave the presentation on that note. I do want to share evidence-based approaches that parents are supporting and that researchers are finding are leading to hope for children and for youth today. So in this environment, so I do have one other slide just to share why Moxie, to answer that question, because as we started, you all saw Moxie Girl, and in your mind, you may have thought, okay, well, she's talking about youth. She's talking about some of these challenges that are prevalent across, but why Moxie Girl? And for us, when we started Moxie Girl, our mission was always to start by addressing girls, because girls are disproportionately affected by some of these numbers than boys. And so it's not to say that boys aren't also facing these challenges. But when I started working in the field, I actually came from always in Tampax. So I was doing some innovation work at Procter & Gamble, and I was working on the software side where they were working, the consumer development folks inside of P&G were working on, building out the actual physical products that show up in a girl's life at a very vulnerable moment of change in her life as she's going through adolescence. And my eyes were really open to the consumer problem of this lack of confidence that girls have, and the actual, not even lack, but the loss of confidence as they go through adolescence. So that's what got me really curious about why girls and confidence, and I was also very personally going through my own confidence challenges as a 35-year-old woman stepping into an executive role at Procter & Gamble. So I was seeking professional help and then learning about young girls who are going through very similar challenges. And that's really what opened up our mission for Girls First. But it began to expose us to this challenge for youth across the board. So right now, we're working on the mission for girls because they're 3 times as likely as boys to face depression. And there's a lot of evidence that shows, even through COVID, that they're more disproportionately affected because of the isolation and because of some of the challenges and the relational challenges that youth are facing today. So hopefully that answers why youth and why we should care about the challenges that youth are facing today, and also answers a question about why Moxie Girl. But the data that I'm going to show going forward is really, really hopeful for how we can start to bring solutions that drive radical change in lives and give hope to youth. And really, at the end of the day, when people say, what do you do at Moxie Girl? We're on a mission to connect 10 million girls to hope over the next 10 years. And on that journey, we're also going to connect youth and boys and families as well. But we're in the business of delivering hope through evidence-based solutions in the palm of someone's hand. So the next couple slides that I want to share, I think can be great insight for you all as you think about maybe the wellness programs you're offering, or even as you think about just conversations with families or with parents or within your own personal networks about how to bring some solutions to youth today and over time. And feel free to jump in as I go through these. I'll stop at the end of each of these slides to kind of talk through. So like I said, I want to share a realistic picture. I don't want to leave you hopeless. There is hope. There are a lot of emerging opportunities to support youth and ultimately in turn support families' mental health. So peer support is, and it's a model that's been around for many years. It kind of started to emerge in the early 2000s, actually, as the conversation about mental health has kind of changed throughout the years. So, early, I'm going to butcher the actual years, but back in the early 1900s and mid 1900s, there was kind of this belief in the medical community that mental health diagnosis was something that one could not recover from. And so that was kind of the early beliefs around mental health and recovery. And now today, the past 20 years, a lot of evidence has emerged to show that, mental health there are paths to recovery. There's evidence to show this, and peer support is emerging as a really trusted source of support for mental health and behavioral health recovery from behavioral illnesses and mental illnesses. It's typically, it started kind of in the adult community with substance use disorder. So this idea that a peer is a person that we can identify with in some capacity. So in recovery, in the recovery world, that's typically someone with a shared experience. So someone who has either had a behavioral illness or a mental illness, maybe it's a substance use disorder or past trauma, and they have gone through to recovery, and they're on the other side. Think of it as almost reaching through that chasm and helping pull people across. And so it's not a replacement for clinical care, and it's not a replacement for any sort of realm of clinical support, but it comes as a really strong evidence-based approach that can help sort of decrease the stigma around a diagnosis and also increase the health outcomes when folks who are going through recovery are paired with a peer. And so for youth, this is a really, really strong support case for how to help youth as a prevention tool. If youth are struggling, maybe there are screening tools that are showing, youth might have a likelihood to be depressed or they're dealing with loneliness or isolation. Peer support is a great model to introduce because it's a group of people who look like that peer, who have been through similar experiences, social anxiety, depression, again, even much more traumatic experiences as well. And these people have compatibility, and there's the ability to build trust in a way that might not come as quickly in a clinical relationship. So it's a growing trend, and there's a lot of data to show the value of it. So I put one of the most striking outcomes on this slide because I wanted to showcase just how this can translate into literal dollars and cents. That peer support reduces hospital readmission rates by 56%. This is something we've been having conversations with at the state level around how can we start to deliver more virtual peer support in those moments, when youth are checking, when youth are in the hospital or when they're checking out, so that in the moment you have someone who is there to walk with you, to listen, to be present, but then also to check in on you throughout your recovery. Could be 3 months, could be 6 months, could be longer, but you have that person who is there almost as a mentor to walk with you through that. So there's a lot of other data. I didn't want to overshare the data, but I can, if any of you all are curious about peer support and the outcomes, I have a lot of other data I can share as a follow-up. But there's evidence to show peer support helps increase self-confidence, increase a person's ability to feel a sense of control and bring about a change in their lives. A number of the youth that we work with, their lives are under someone else's control, or maybe they've moved in and out of different systems. And so they want to have a sense of control about maybe the goals that they're setting or how they're going through recovery. And peer support can kind of bring that familiarity and bring that, lower the stigma and lower the barriers to conversation to help give them a sense of control. There's also data that shows peer support helps decrease substance use and depression and increases engagement and also activation in treatment. Because, for folks who might be resisting treatment or might not feel comfortable reaching out for help, a peer can offer that approach of, look, I've been there. I understand. This is hard. This is difficult. Let's have a conversation about it, which might be that next step towards a person's recovery. So overall, there is tremendous value in peers and in that model. And that's a way that we work, is we recruit college age and master's age females who have been through the traumas that the girls that we're serving today have been through. So what's interesting is there's also a lot of data to show that when peers are able to have that conversation, the peer is also benefiting. And so you're looking at almost this dual approach, kind of a marketplace of recovery. You're helping the person who is going through trauma or going through, a need to go through recovery and going through that journey. But the person who's offering help is also receiving benefit. And there's evidence to show that that is the case. So before I move on and talk about how parents feel about peer support, any thoughts on this or any questions based on what I've shared?
Lydia, I'm going to ask, how do you recruit the old, because again, like literally I'm thinking, all right, I'm going to, be personal. I have a 20-year-old daughter who just went through everything that we're concerned about. And honestly, what my other reaction was to, I don't remember what something you said, but the girl that was impacted by that, she was not in a difficult situation. Mm-hmm. to be candid. She had a charmed life, but she had a disease. She really didn't recognize. She was probably the most befriended girl in their entire group. It was just it was a very difficult situation for that reason. She was not in she's in a loving 2-parent family and, et cetera, and had everybody thought that they were her friends. So it was just a very strange scenario. So it makes me, it's a recognition that everything else that could be going on in a girl's or boy's life makes it even worse, so what I'm curious, I guess the point I was getting to is how do you go about finding those kids that are interested in doing this? Like, how are you recruiting? I'm just curious how it happens, really.
Yeah, that's a great question. And it's one we get often. So we are actively recruiting. So if anyone knows, so Matt, if your daughter's interested, I'd love to chat with her. And if anyone, has folks in their network who you think might be interested in this opportunity, we're absolutely always looking for women who are willing to share their story. So for peer support, the way that the model works is to be certified peer support specialists, you have to have had a lived experience. And so, Matt, to your point, it could be exactly what your daughter went through, and that is a lived experience. And then there has to be willingness to share that story or share how you recovered as a way to help the other person recover. And if you think about it, that's community building. So it really at its core, it's humanity, it's friendship, it's how we build others up by using our experiences. Even as an entrepreneur, it's like you think about it, independent of the mental health space. If I get a call from an entrepreneur who says, can you help me figure this, and this out? Absolutely, I'm there because I've been through that, So I think taking it to the level of mental health, and when you've been through trauma and when you've been through things that you want to help people either get through it or help people avoid that as they've gone through life. So we recruit through networks like this. We recruit on LinkedIn. We talk to colleges and universities, like U of L. We have a number of peer supporters from U of L who are, we have peer supporters from all across the US. I want to say we're probably about 30 colleges and universities represented across the US, but even just college age and master's age. So whether or not a girl has gone through a college or university, as long as there's that willingness to share the experience, there's a training that they go through, there's a certification process, And then it's an incredibly flexible opportunity to give back because it's virtual. So our peer supporters are able to come in through the mobile app, and they really decide how many girls they want to work with and for how long. So it's a really flexible work opportunity for them to get incredible experience in a clinical environment as a paraprofessional, as they're kind of trying to figure out, what they might want to do with their life career-wise, or if they have a career, it's a nice side gig, to put it as simple as that. Does that help answer?
Thank you. Yeah, absolutely.
Welcome. And I'll put that in the references too. We have a link on our website, so you are welcome to share that out with anyone who might be interested. We'd love that.
I was just
go ahead.
I can't put the site in the chat box, but obviously we'll have it on our site as well.
Perfect. Yeah. So to that point, we get stories from our peer supporters too, which is really interesting. People say, well, why do people sign up to be a peer supporter? And what we've noticed is that in some of these conversations, sometimes this is the first time where an individual can look back at what they've been through and they can see an opportunity to use it for good. And I think that is interesting when it comes to recovery, is the opportunity to help change the narrative that, maybe what happened to me wasn't all, it was traumatic, or yes, it was a terrible experience, but now I have a chance to help someone else, or I have a chance to see hope in that. So that's, again, goes back to why we're, in the business of bringing hope. And I think we can all use that these days. So a question that might be on your mind, here's data that shows the value of peer support, but what do parents think about peer support? There was an interesting study that just came out, actually, goal setting. I'm going to skip that really quick because I want to get to the parent peer support. There's an interesting study from the University of Michigan that just came out that showed that 3 in 4 parents think that peers better understand teen challenges versus teachers or counselors. And again, this might not be news, especially if you're a parent of a teen. I'm a parent of a 4-year-old, and she already thinks that her peers have better advice than I do. So, I imagine teen years are going to be that much more fun. But I think it goes back to that model of how can someone relate to what I'm going through. When we talk to parents today, we feel like a lot of times parents are riding the wave of what their children are going through. Social media, it did not exist in the way today, or 10 years ago, that it did today. The prevalence of information, the always on nature, the struggles that come with that. Even something as simple as, back in the day, you didn't know that you weren't invited to the party on a Friday night. But if you're flipping through Snapchat or Instagram and you see friends out doing something, in fact, a lot of teens, there's research to show that through COVID, there's this feeling, pediatricians have shared with us, that teens that are coming in, they feel like everyone else is doing okay but me. So they'll see 2 or 3 friends together, maybe even socially distanced, while they're sitting at home. And then that kind of creates this narrative of like, everyone else is struggling, everyone else is doing okay, I'm the only one that's struggling, which reinforces that feeling of isolation. And so that, again, reinforces why the value of peer support, the empathy and the compassion that can come from a peer can help. And so peers are really an untapped resource. And that's a way that we can help offer support to teens. I want to be sensitive to time. And so I just wanted to share one other data point on goal setting as another way to really bring perspective towards improved mental health and improved mental wellness. So again, research, there's data to show that when teens and youth are going through therapy, that if they set goals at the beginning of that therapy session and at the beginning of that relationship, that there's higher retention in treatment and that there are links to stronger outcomes. And I think if we take a step back across the board, is we actually know fundamentally that goal setting drives self-efficacy, or it's goal setting and goal achievement drives self-efficacy. And at its core, self-efficacy is confidence. That means I believe I can, And so just the very act of setting a goal, which doesn't have to be, I'm going to be a doctor one day. That's a great goal, but the goal could be, I'm going to try a new vegetable today, or I'm going to drink water, or I'm going to go outside for 15 minutes today. Well, maybe not today, but I'm going to I'm going to look outside. I'm going to count the birds in the tree, whatever it is. But I think one of the ways that we can help families in general, and we can especially help youth, is reframing perspective and changing the story about achievement. So your goal might have been for senior year to make the varsity team, and maybe that is just not an option right now. And so reframing that goal, kind of talking with youth about, what was it about that, or what other things can we do today in our new normal that can still give a sense of achievement, can really change the conversation and can really lift spirits in a way, that social media and Netflix and chill can't. So I think I wanted to share that data as just a very practical way to change a conversation. And we have a lot of resources I can share just around, goal setting methods, a lot of mental health, agencies across different states that have solutions and resources too, and just suggested goals, that can help. But I think that's just an important part of the conversation that can really help change perspective on youth mental health and on just wellness as a whole. And so before we wrap up, I did want to share, in case you're wondering, how does Moxie Girl fit into the equation? We help girls and over time youth with virtual peer support. So in the palm of her hand, a downloadable app or an app accessible on a web browser that gives girls and young women, teen girls and young women, access to college-age females, master's-age females across the country who have been there, who are there to support, and who are available via text or video call to be present in a girl's life. We also have screening tools. That's something that we have implemented only recently, but to really understand the mental state of girls. So likelihood for depression, wellness, different ways to get at how are they doing with the support networks in their life in a virtual way. So, again, I mentioned telehealth is something that is, it's something that states are becoming much more open to. States are expanding funding for telehealth. I know Medicaid in many, many states is, the governors are proposing that there is an expansion of the types of services that are covered, and also the types of, or the availability in different areas. So this is a growing trend of looking at how we can access and provide support virtually. And, lots of research has showed different tools that can help. I think, someone mentioned Teledoc in the chat, and, a number of other great resources for youth and for families. Because at the end of the day, when children feel better, parents feel better too. And so to sum it all up, why youth? They're hurting. We're all hurting, in different ways, but youth especially. Why girls? 3 times more likely to face these challenges. And, why now? Because we need ways to help families feel better. And one of the ways we can do that is by helping the youth feel better. So that is why now. And that's why Moxie. Any questions or thoughts? Comments?
Looks like there's again, I'll just remind everybody that Candace did put in the chat box is the website. The question was, is there a cost to the app? I mean, how's this play out?
Yeah, great questions.
Users or whatever.
Yeah, so there's not a cost to download and use the app. The app, our aim is to always keep the app itself and the tools in it free. The way that, thank you, Marcy, for that feedback. The way that we work with providers is there is a cost to how we provide that peer support in a clinical setting. And so we come alongside behavioral healthcare providers and we partner with them to offer peer support to their clients. And then any parents who want to access a peer supporter over a longer period of time for their child, we have an easy out-of-pocket cost that they can pay as well. And it's a Medicaid covered service. So for anyone who's on Medicaid, the service is reimbursed across 39 different states. And then, low out of pocket cost on a monthly basis. And then we're also, as I mentioned, we're implementing some screening tools. We're looking at ways, if corporates want to use the screening tools themselves, we do have some options for, subscriptions to, having youth go through the screening tools and then providing that data back to you. It's a really thoughtful way to capture the data and an easy way to get a broad-based assessment for parents or for companies that are interested in that. So costs really from a business-to-business standpoint, or for consumers who have, parents who have children, if they want to pay for the mentorship through the app. Oh, and I see a question from RD. What type of certification do the peer specialists receive? And Marcy has answered that. Yes, peer specialist, it's an official profession. And it's a profession that's increasingly being covered under telehealth across the board. So it's a state-approved curriculum. It's a curriculum that so organizations like Moxie work with the state, and also the state provides to opportunities for folks to go through and get that certification. And then there's a continuing education, and there's a test that you have to pass, and different procedures you have to go through to actually get the certificate. But then to maintain that over time, you go through continued training and support for that.
I just wanted to say, this is Annetta, and I wanted to commend you for this, because I believe that we need to start somewhere, and with the youth, that's where we need to begin. And I think this is a wonderful program, because I coach adults in corporate America on stress resilience, and you forget about sometimes the youth. You need to begin there to make sure that they understand it's okay to reach out to get help when they need it. And I've coached some girls that are in college right now, and it is amazing the things that take them down, and they just have nowhere to turn. And so the end result may be like what Matt and his daughter experienced with a friend, and to have this outreach is fantastic. So I would love to partner with you. So I'll be in touch.
Thank you. Yes, please do. And what you said gave me chills, because it's so true. The things that take them down. I remember in our early research around Moxie Girl, we would talk to girls. We talked to so many girls across Louisville, so many girls across different states, and the tears that would come to their face. Two things: the tears that come over not achieving expected things. So this, perfectionism, all of these things that kind of come into play in a girl's life, but also the words that they used to describe the setback were harsh. I mean, they'd be talking about, you're getting out of bed, you got your game face on, you're gonna have a great day, and maybe you didn't get the grade on your test, or maybe someone said something, and words like bam and jolted, and just these very harsh words that would bring them to tears when they would share their story about that setback. And you think, man, you can have you look at these girls, you look at youth, and on the outside, everything looks okay. Like Matt was saying, things look okay, and on the inside, that's not always the case. And so I think a big part of this is like, how do you just show up to get girls and youth and adults? We know this is true with adults, but just get people talking. Let them know that it is okay to not be okay. And I think, it's hard. It's very hard for me to share statistics like I opened up, the presentation with, because I think we want to be optimistic, and we are. We all want to have great conversations. We all want to have smiles on our face. But I think some of the challenges that come with that when you're not having those hard conversations is that it can look like everyone else is okay, so I need to put my okay face on, and it's not okay for me to share that I'm not okay. And so how can we continue to create these outlets for conversation, and then the support after that conversation happens? So thank you for that feedback. Anything else before? I know we're almost right at time, and we probably have other Zoom meetings to hop into.
Well, I'll tell you what. So I don't see any other questions. Again, what we will do is we will post this recording and also the other materials that Lydia follows up with. So just send those to us. We'll get them posted. Again, I will thank you all for taking the time to join us this morning. Great conversation. I mean, not just thought provoking, but I mean, it is obviously it's a meaningful topic, and it not just for individually, but obviously we work with, we all work with other folks who have situations that we can't always understand or we don't always recognize. So I think this is a great topic, especially having moved successfully away from 2020 into the new year. So thank you all so much for joining us. Look for an update about next month's topic. Patrice, is there a specific topic that you want to go ahead and tease about? You're muted.
Hello, everyone. Yes, next month we have our topic is going to be, I believe it's RX. And it's a great company, and there will be more to come. So we're looking forward to each and every one of you showing up next month for our conversation. And thank you in advance.
Well, great. Well, so again, to everybody, thanks so much for joining us. Hope you have a wonderful rest of the week. Stay safe, warm, off the roads, or I guess sort of today is probably okay to get back on. But anyway, we appreciate you joining us. Have a wonderful day. Lydia, thank you so much. We enjoyed the presentation.
Matt,
Thank you so much.
just before everybody leaves, there is a question for Lydia. They wanted to know, do you or were you able to do lunch and learns? That's important.
Yes. We love doing lunch and learns. So
Okay.
feel free to let me know if you desire that. Absolutely.
All right.
Well, we'll have your contact information on our website. Again, thanks everyone. Have a wonderful afternoon and a wonderful day. We'll talk to you soon.
Thank you.